CNS stimulants are substances that trigger the release of chemicals within the brain. They are commonly used for ADHD, narcolepsy, weight loss, fatigue, and respiration stimulation. Drugs used for ADHD include amphetamines such as Vyvanse, Adderall, Dexedrine, and amphetamine-like drugs such as Scopolamine and Ritalin. Side effects of amphetamine and amphetamine-like drugs include restlessness, insomnia, tachycardia, hypertension, heart palpitations, anorexia, vomiting, and diarrhea.
This will make me better in class, and we'll find out.
Drugs used for weight loss include phentermine, Diedrex, Belviq, and Tenuate.
I'm just so hungry all the time, and I just can't stop eating. Everything just tastes so good. I just keep trying to lose weight, and I can't. I just diet, and I exercise, but I'm just still so hungry.
Side effects of anorexins include nervousness, insomnia, restlessness, irritability, hypertension, palpitations, and renal failure.
So I went to the doctor 2 weeks ago, and I talked about my problem with my eating, and I couldn't stop eating. He told me to try phentermine. Takes about 2 weeks to work. I'm not even hungry anymore. Can't have caffeine while you're on phentermine. That's a bad deal. I just don't want to eat any of this stuff anymore. He told me I should eat healthier, so I'm going to have some water and some fruit instead of all of that bad food. And I'm not even really hungry.
Drugs used for mental alertness include caffeine, B12, ginseng, and ginkgo biloba.
I'm just so tired. All this studying, the reading, physical assessment, blah, blah, blah. Ugh, I'm tired.
Side effects of caffeine include restlessness, tremors, twitching, diuresis, diarrhea, palpitations, and nervousness.
Oh, caffeine. Take some of these. Although I've already drank 2 or 3 coffees. Oh, and I just can't sit still. And God, I gotta pee now. Is it hot in here? Oh.
Contraindications of CNS stimulants include hyperthyroidism, anxiety, history of seizures, hypertension, coronary artery disease, Tourette's, glaucoma, psychosis, and mental disease. CNS stimulants should not be used in children less than 6 years old, people with depression, substance abuse, or those that are pregnant. Patient teaching includes taking medication before meals, avoid alcohol while taking these medications, avoid caffeine and other stimulants, do not stop taking abruptly to avoid severe withdrawal symptoms, avoid long-term use of anorexins, and monitor weight for sudden decrease. CNS stimulants can be highly addictive. Amphetamines and anorexins run a high risk of abuse. Drugs must be titrated up and down to avoid severe side effects. Avoid use in patients with cardiac disorders, history of seizures, hypertension, psychosis, and depression. Monitor heart rate and rhythm, blood pressure, signs and symptoms of depression, and dependence.